Hi everyone, Assalamualaikum. My name is Nur Atika binti Nurizam, matric number 190103016, program D Part 3. Today, I would like to present article about irritable bowel syndrome symptoms diet treatment. This article is from MedicineNet, published on Tuesday, 13 October 2020. MedicineNet is an online healthcare media publishing company. We provide easy-to-read, in-depth, authoritative medical information for consumers via its robust, user-friendly, interactive website. Founded in 1996, MedicineNet.com has had a highly accomplished, uniquely experienced team of qualified executives in the fields of medicine, healthcare, internet technology, and business to bring you the most comprehensive sought-after healthcare information anywhere. Nationally recognized doctor produced by a network of more than 70 US board-certified physicians. MedicineNet.com and onhealth.com are trust-search Webster's New World Medical Dictionary, authored by MedicineNet for online health and medical information. What is irritable bowel syndrome, IBS? Irritable bowel syndrome, IBS, is a chronic disorder in which the intestine do not work normally. Other names for IBS are spastic colon or functional bowel disease. The consequences of the malfunction of the intestines is abdominal pain that is associated with constipation, diarrhea, or constipation alternating with diarrhea. The disorder affects at least 10% of the population of North America. IBS symptoms: abdominal pain that is associated with constipation, diarrhea of birth. The pain and alteration in bowel habit may be mild and not interfere. IBS causes: it is believed to be caused by abnormal activity of the muscles of the intestine and or the nerves that control the muscles. This can lead to abnormal patterns of contraction of the intestinal muscles that result in pain, constipation, or diarrhea. Who's at risk for IBS? IBS is more common in women than men, almost twice as common. Although the symptoms can begin at any age, they most commonly begin in people in their 20s. IBS diagnosis: there are no tests for diagnosing IBS. Occasionally, the activity of intestinal muscles is studied and found to be abnormal. It usually is the typical symptoms of IBS: abdominal pain associated with constipation, diarrhea of birth, that suggests the diagnosis. Since many other abdominal disorders also cause these problems, it often is necessary to do tests to make certain that other gastrointestinal abdominal diseases are not present. How IBS impacts daily life. When the symptoms of IBS are mild, they do not interfere with activities of daily life. When they are severe, they may limit activities because of the pain or the need to go to the bathroom. Patients with IBS and diarrhea need to be constantly aware of the location of the nearest bathroom. Patients even may avoid going out socially to avoid the embarrassment of frequently going to the bathroom. Stress and IBS. Stress worsens the symptoms of IBS just as it worsens the symptoms of most other disorders, but stress causes few, if any, disorders. Nevertheless, reducing stress is one reasonable approach to improving the symptoms of IBS. Sometimes, reducing stress is enough to make patient comfortable, but usually is more required, especially when symptoms are severe. Troublesome symptoms of IBS can cause stress, which in turn makes the symptoms more troublesome, a vicious cycle. IBS triggers. Practically speaking, it is important to identify any factors that aggravate the symptoms of IBS, whether it be certain activities, certain foods, or some medications. Not specific foods have been linked to IBS, so there is not IBS diet. Nevertheless, it may be worthwhile to keep a food diary that may help to identify foods that are associated with worsening of symptoms. The foods then may be avoided. IBS treatment, diet change, prebiotics, drugs for the hair, drugs for constipation, antidepressants and antispasmodics, peppermint oil, psychotherapy, hypnosis, biofeedbacks, relaxation therapy. Diet change. Some foods may aggravate the symptoms of IBS because they alter the function of the intestinal muscles. For example, caffeine may stimulate muscle contraction. Fatty foods, on the other hand, can reduce muscle activity. Other action might aggravate symptoms of IBS depending on what the abnormality is that underlies the IBS. Sometimes certain food intolerance, such as to lactose or fructose, may aggravate the symptoms of IBS. Though they are not the cause of IBS, their elimination from the diet may improve symptoms. IBS and exercise. Exercise is a stress reducer and it can be used to moderate the symptoms of IBS. How it works is unclear, but it does not necessarily take vigorous exercise. Before entering any exercise program, however, you should check with your doctor. My opinion. This article can help people to be careful in choosing food. They usually must obey with physician interview because it is important to specifically ask about this agent in a non-judgmental fashion. That's all for today. Thank you.